How to improve kidney health, Part 2. In the previous video, we discussed the importance of diet in maintaining good kidney health. We saw that a high-protein diet can be harmful to the kidneys by causing hyperfiltration, the first stage of kidney impairment. We also learned that plant proteins do not have this harmful effect that animal proteins have. Hence my advice to those with CKD to eat a plant-based vegan diet. It is a sad reality that many medical providers do not advise a low-protein diet for patients with chronic kidney disease until the latter stages, stage 4 or stage 5. But perhaps this is because of a misunderstanding of how a low-protein diet could be very beneficial, even in those with earlier stages of CKD. We are probably missing an opportunity to slow down the progression of CKD and even reverse it at the early stages, stage 1, 2, or 3A. In a prospective cohort study involving 1624 women enrolled in the Nurses' Health Study who were between 42 and 68 years old, researchers made an interesting observation. They found that in women with mild renal insufficiency, defined as estimated GFR greater than 55 mol/min/1.73 schem, a high intake of protein, especially non-dairy animal protein, led to a significantly rapid decline of renal function compared to those with normal kidney function. This goes to show that the adoption of a low-protein diet could be beneficial even at the earliest stages of CKD. Others have used a very low-protein diet, VLPD, in the treatment of CKD and found that such a diet reduces metabolic acidosis in CKD patients, as well as reduces blood urea nitrogen, BUN, and serum creatinine, the common measures of kidney function. The advantages of plant protein compared to animal protein bear repetition. This is because many people think all proteins are equal. But a protein is a protein is false in our health and halting the progression of kidney disease in particular. Studies have shown that animal proteins can harm the kidneys, especially already impaired kidneys. But they have found that plant proteins do not cause any kidney injury. A study involving healthy volunteers with normal renal function and patients with diabetes showed this. It found that a tuna meal led to hyperfiltration, the prelude to acute kidney injury, in diabetic patients with macroalbuminuria, but bean curd did not. This is such a profound finding because of how many people view fish. Many people stop eating meat and just eat fish in order to be healthier. In terms of its effect on reducing the decline in kidney function, a low-protein diet seems to work synergistically, hand in hand, with a low-sodium and low-phosphorus diet. Researchers have found that restriction of protein to 0.6 grams per kilogram of ideal body weight, phosphorus restriction of 600, 1,000 mg daily, and sodium restriction of 2,000 mg a day significantly reduce the rate of progression of CKD patients with type 1 diabetes. They compared the low-protein diet to a control diet, which comprised the patient's pre-study diet as long as it contained at least 1 gram/kilogram of ideal body weight and sodium of 2,000 mg and phosphorus of 1,000 mg. The authors advised providers to use this diet more often for this population of CKD patients. It is quite clear that protein restriction, though often mentioned, is not seriously emphasized in patients with CKD. It is usually when patients have entered the later stages of CKD that we emphasize protein restriction. Medical providers emphasize phosphorus restriction normally when patients have ESRD and are on dialysis. What is quite interesting is that it is easier to restrict phosphorus when you restrict protein because most high-protein foods are also high in phosphorus content. In the next video, we will discuss how a diet that is low in phosphorus can help improve kidney function. In the meantime, for more information, get the book, Reverse Chronic Kidney Disease: How to Improve Kidney Function and Avoid Dialysis. Available on Amazon as an ebook and paperback. Thank you for watching this video. Please like the video and subscribe to the channel so you don't miss any of our future informative videos.